pleasure to present our research on the elderly immigrant poverty here at the Institute for Life Course and Aging. What I'm going to present today is based on the article that Monica Boyd, who is Canada Research Chair and Professor of Sociology here at UT, and I published in the Canadian Journal on Aging last spring. So to begin with, I'm going to the bottom line of my presentation. Income security of older people have been a much debated topic over the past month. The debate was in fact triggered by Prime Minister Stephen Harper's speech to the World Economic Forum in Davos, Switzerland in January, which suggested pension reform to make retirement support programs sustainable. Although we don't know the details of pension reform until the 2012 budget is going to be announced, raising the age eligibility of the Old Age Security, OAS, from 65 to 67 is the main debating point at the moment. This is closely linked to today's talk on elderly poverty, given that low-income elderly persons are usually relying heavily on OAS, as well as Guaranteed Income Supplement, which is a top-up program tied to the OAS. However, what is missing from this current debate is who we are exactly talking about, or among older people who are more vulnerable to income security like poverty. In fact, many of the low-income elderly are immigrants who were born outside of Canada. For example, in 2006, 30% of elderly immigrants who are in Canada for less than 20 years were living in poverty, which is much higher than the national average of 10% in 2006. This poverty gap between immigrants and Canadian-born elderly suggests that there is a disparity in government social support for the elderly, which may make elderly immigrants more vulnerable to poverty. At the same time, today's elderly immigrants are coming from diverse ethno-cultural backgrounds, and some of them may have strong family support which could help them escape from poverty. So the puzzle in this debate is, how does the government support and family support influence the poverty of elderly immigrants? To date, no Canadian research has empirically tackled this puzzle. Our study did by analyzing the 2006 census data. The analysis shows that elderly immigrants, especially the ethnic groups that came to Canada more recently, are vulnerable to poverty, which is partly due to their limited access to government support. And we also found that elderly people are still protected from poverty because of their family ties. In other words, their greater propensity to live with their children could help them escape from poverty. So first of all, I'm just going to put the issue of elderly immigrant poverty in perspective. Since 1970s, elderly poverty has declined rapidly in Canada, which is a stark contrast to the poverty among younger groups. Researchers often equate this rapid decline in elderly poverty with the proliferation of government social policies for seniors. But this downward trend masks the fact that elderly immigrants, particularly recent arrivals, have much higher poverty levels than these statistics show. To study the poverty among elderly immigrants, in comparison to the Canadian-born, we considered two factors. First, state or government support, and second, family support. In welfare states like Canada, the government plays a key role in securing income for older people. And there are three kinds of income security policies in general. First, universal pensions are pay-as-you-go flat rate benefit for people who reach certain age, like 65 years old. Second, social insurance is provided based on your earning history when you were in the labor force. Third, social assistance targets elderly persons who are in the bottom rungs of income distribution, which is provided through income supplements. These income maintenance policies are indeed reflected in Canada's retirement income programs. Universal pensions are available in Canada in the form of old age security, which is a non-contributory pension provided to any Canadian citizens or legal residents who are age 65 and older and have lived in Canada for 10 years or more after they turn 18 years old. Social insurance includes the Canada-Quebec Pension Plans, CQPPs, which is provided to people who are in the labor force and contributed to the plan alongside their employers. In order to qualify for the full benefits, you must contribute for 40 years or more. Social insurance also consists of occupational pensions and registered retirement savings plan, RRSPs. Admittedly, these retirement income programs are in the private domain, but since contributions to these plans are deducted from taxable income, we can say that the government is tacitly involved. Finally, social assistance includes the Guaranteed Income Supplement, GIS, which is provided by provincial governments to the OAS recipients who have limited or no other income. Such state support systems have several implications for the poverty of elderly immigrants in Canada. First, OAS 10-year residency requirement may affect recently arrived immigrant seniors who haven't accumulated sufficient years of residence in Canada. Second, immigrant elders who arrived recently are also less likely to meet CQPP's long-term contribution requirement for obvious reasons. Third, immigrants who are sponsored by their families are not eligible for social assistance up to 10 years after arriving in Canada. This is because the sponsoring families have to sign up an undertaking contract with the Citizenship and Immigration Canada that they will financially support their elderly family members without relying on social assistance. Moreover, as the precarious employment literature suggests, immigrants are less likely to find good jobs that provide good benefits, including private occupational pension plans. Furthermore, women and ethno-racial minorities have less access to work-related pensions like CQPPs and occupational pensions because of their disadvantageous positions in the labor market. With these implications in mind, we expect that elderly immigrants' limited access to state support is associated with their higher poverty rates. Because elderly immigrants, particularly those who recently arrived in Canada through family reunifications, have limited access to state support, family is considered as the primary institution in the private sphere for the income security of seniors. However, it is not easy to empirically study the amount of financial help that elderly persons receive from their family members because such information isn't readily available in survey data like census data. To get around such data limitations, researchers often use living arrangements as a crude measure of income support for families. For elderly persons living with kin, including children, grandchildren, and other relatives, mean the pooling of income as a household. This can be an effective way of escaping from poverty by taking advantage of the economy of scale. To incorporate this idea, our study uses living arrangement as a measure of family support, and we expect that poverty among elderly immigrants will be alleviated to some extent because of their higher propensities to live with their family members. We also consider ethno-racial and gender variations in their living arrangements. It is widely known that the elderly from some ethno-racial groups in North America, such as Southern Europeans, Asians, and Latin Americans, have higher propensities to live with their kin, and they tend to form larger families, whereas Northern and Western Europeans, including the British, Germans, and Dutch, are more likely to live independently. Admittedly, whether this is explained by their culture or economic factors is a debating point. But our study is not going to engage in this debate. Instead, we're just going to take into account such variations by studying the poverty levels of a total of 31 different ethnic immigrant groups. And we expect that elderly groups that are known for living with kin, such as Southern Europeans, Asians, are more likely to be protected from poverty. And here are the three research questions that are addressed in this presentation. First, how does the poverty among elderly immigrants compare with that of the Canadian-born elders? Second, to what extent does the poverty of elderly immigrants reflect state policies? And third, to what extent is the poverty of elderly immigrants alleviated by financial help from their families? To answer these questions, we analyzed data from the 2006 Census Public Use Microdata file. The sample is persons who are age 70 and older, who are permanent residents of Canada, and were living in private households at the time of the census. We selected persons who are age 70 and older for two main reasons. First, we wanted to ensure that everyone in our sample has turned 65 and older by January 2005 and was eligible to receive OAS throughout the 2005. This is because total family income for 2005 was used to determine the respondents' low-income status in the 2006 census. This automatically restricts the age group of the analysis to people who are age 67 and older at the time of the 2006 census, which was May the 16th, 2006. Second, the 2006 census public use file calls age in 5-year interval, such as 60 to 64, 65 to 69, and 70 to 74, and so forth. Therefore, we were unable to select people who are age 67 and older. Instead, we focused on people who are age 70 and older. Permanent residents include both non-immigrants who are Canadian citizens by birth and immigrants who are born outside of Canada and were given the right to live in Canada permanently. We didn't include elderly persons who are not in the private households, such as people who are living in nursing homes and hospitals. The dependent or outcome variable of our analysis is an elderly person's poverty status. We use low-income cutoffs before tax, which is a common measure of poverty among researchers in Canada. If an elderly individual's total family income in 2005 was below this cutoff, then he or she is considered as being in poverty in our analysis. Since the outcome variable is a dichotomy, we use a technique called logistic regression to estimate the probability of being in poverty under certain conditions. I'm not going to detail this statistical technique right now, but if any of you are interested, I'm more than happy to explain this technique during the question period. To assess the impact of state support and family support on poverty, we include these measures as the independent variables. We expect that not receiving OAS, CQPPs, and retirement pensions will increase the chances of being in poverty. By contrast, social assistance payments, which is captured by other income from government sources, are offered on the basis of financial need. So, not receiving this income may signify economic advantage, meaning that people who are not receiving this income are less likely to be in poverty. As for family support, we expect that those living with kin, including people who are married and living with children, those who are living in multiple family households, and those who are living in non-family households with relatives are less likely to be in poverty, assuming that they have family financial support in their household. In addition to these independent variables, we also control for age, language use, the highest level of education, city of residence, and year last worked. And these factors are also expected to influence the probability of being in poverty. Our analysis compares the poverty levels of 31 groups divided by the nativity, meaning that whether you are born in Canada or not, and ethnic origins, and the ethnic group's immigration history. And those 30 groups are aggregated into 3 larger groups. In the first group, we have Canadian-born elderly persons of various ethnic origins, including British, French, Germans, Ukrainians, and so forth. For immigrants, we categorize them into 2 aggregated groups by the ethnic group's immigration history, which is the old wave group and the new wave group. We classify the ethnic groups that immigrated mostly before the 1970s as the old wave groups, including European origin groups like the British groups, like the British, Italians, and Germans. We then categorize groups that immigrated mostly after 1970s into the new wave group. They are predominantly of non-European origins, mostly Asians, but also we have Caribbean, the Middle Eastern, and Africans. In the following analysis, we set the Canadian-born British as the reference group because historically they have dominated the major institutions in Canada such as politics, military, business, and education as a privileged population. So what do we find from our data analysis? To answer the first question of how does the poverty of elderly immigrants compare with that of the Canadian-born elders, we looked at descriptive statistics where we didn't control for any other factors in the beginning. This graph shows that on average, foreign-born elderly of new wave, which is these bars, they have higher poverty rates. While the poverty levels of immigrant elders from the old wave look quite similar to the poverty levels of the Canadian-born elders, we also find noticeable gender gaps, especially among Canadian-born and foreign-born old wave groups. Women are far more likely to live in poverty than elderly males. So now we're going to focus on the old wave immigrants, this group, to see whether there is a variation among different ethnic origins. So the next graph shows the poverty levels of some of the ethnic groups from the old wave of immigration in comparison to the Canadian-born British, which is the reference group. There is indeed a wide variation within the old wave immigrants depending on their ethnic origins. While East European groups like Polish, Ukrainians, as well as Greeks have particularly high poverty levels, Italians and Portuguese have relatively low poverty levels. And we see similar variations for men, although we didn't include the slides in this presentation. And so how about immigrant women for the new wave? So now we're shifting our focus from the immigrant elders from the old wave to the new wave. Again, there is a wide variation within this group depending on their ethnic origins. While more than a quarter of elder women or Jamaicans, other Caribbean origins, and Chinese are in poverty, others have relatively lower poverty levels. In fact, the poverty levels of Filipino immigrant women is not statistically different from that of Canadian-born British women. So far, we have shown the poverty levels of various ethnic immigrant groups without controlling for any other factors. To answer the second and third research questions, to what extent does the poverty of elderly immigrants reflect state policies, and to what extent is the poverty of elderly immigrants alleviated by family financial help, we estimate the probabilities of being in poverty controlling for their demographic and socioeconomic characteristics using logistic regression. Instead of showing a large table with lots of coefficients, we're going to show you bar charts by calculating 3 hypothetical situations for each ethnic immigrant status group. So in the first scenario, we use the characteristics of its own group. For example, the characteristic of foreign-born Chinese elderly women from the new wave. And in the second scenario, we use the distribution of retirement incomes for the reference group, the Canadian-born British. Here, we're trying to calculate a hypothetical situation where elderly immigrants from some particular ethnic group are receiving the same state support as the reference group of Canadian-born British. In other words, we're interested to find out how the poverty level of elderly immigrants would look like if they were more likely to receive OAS, CQPPs, and other retirement pensions, and were less likely to receive social assistance like the Canadian-born British do. And in the third scenario, we use the distribution of living arrangement for the Canadian-born British. Similar to the second scenario, we create a hypothetical scenario where immigrant elders from a particular ethnic group have the same living arrangement as the Canadian-born British, who tend to have a lower propensity to live with their children. So this graph shows the result for immigrant women from the old wave groups under these 3 scenarios, which I described just a second ago. And I'm going to explain how to read this graph using Greeks as an example, this group. So the first bar, which is the blue bar, shows the predicted poverty levels when we control for the demographic and socio-economic characteristics of Greeks, including their age, education, language use, city of residence, year last work, retirement income, and living arrangement. And under such circumstance, 17% of Greek immigrant women would be in poverty. And next, this middle one, red bar, indicates the probability of being in poverty when we control for all the demographic and socioeconomic characteristics of the Greek group, but retirement income. For retirement income, we use the distribution of our reference group, the Canadian-born British, meaning that if Greek immigrant women were as likely as the Canadian-born British to receive retirement income, only 9% of them would be in poverty, which is 8 percentage points lower, or almost half the poverty levels of the first scenario. Finally, the green bar stands for the predicted poverty levels when we control for all the characteristics of Greek immigrant women except for the living arrangement. For living arrangement, we use the distribution of Canadian-born British to create a hypothetical scenario where foreign-born British women were as likely as the Canadian-born British to live independently. In this scenario, their predicted poverty level would go up by 15 percentage points, or would be double the level of the first scenario. This suggests that Greek immigrant women are protected from poverty to a large degree by living with kin, as opposed to living independently. Overall, the ethnic groups that are known for forming extended families, like Greeks, Italians, Portuguese, seem to benefit from co-residence with kin in keeping their elderly poverty levels lower. At the same time, their poverty levels will be lower if they receive state support to the same extent as the Canadian-born British. In contrast to women, immigrant men from the old wave are not that vulnerable to poverty except for Greeks. Overall, the poverty level of immigrant men from the old wave would be slightly lower if they receive the same retirement income as the Canadian-born British, and their poverty levels would slightly be higher if they lived independently like the Canadian-born British. But their predicted poverty levels are not much affected by retirement income or living arrangements, unlike elderly women from the old way. And these are the results for immigrant women of select ethnic origins from the new waves. We see a striking spike in poverty levels when we use the living arrangement distribution of Canadian-born British, like these relatively higher green bar suggest. The poverty levels of other Caribbean, East Indians, and Chinese women will be over 45% if they were as likely as Canadian-born British to live independently. For East Indian and Chinese women, the poverty levels would go up by 30 percentage points if they were not living with their kin like the Canadian-born British. Or, to put it in another way, we see a 340% and 175% increase in the poverty levels of East Indian and Chinese immigrant women if we use the percentage change instead of percentage point change. The poverty levels of these new wave groups would also be much lower if they were as likely as the Canadian-born British to receive retirement income. Similar to the old wave groups, the poverty levels of immigrant men from the new wave are not so affected by state support or family support. Yet, especially East Indian, Chinese, and Filipino men seem to benefit from living with kin because their predicted poverty levels would be much higher if they were living independently like the Canadian-born British men. And finally, in terms of which support has a larger impact on elderly poverty, state support and family support, and our results show our additional statistical tests suggest that state support and family support equally influence the ethnic immigrant variations in poverty for women, whereas family support has a less impact on the poverty of elderly men. This means that family support has relatively larger impact on the poverty of elderly women than men. This reinforces the argument that the poverty of elderly women can be explained by variations in living arrangements which reflect the differences in the economic well-being between elderly women living independently and those living with kin. To conclude, our study demonstrates that older people, especially women from the new wave of immigration, are vulnerable to poverty among the elderly population in Canada, although there is indeed a wide variation in poverty levels among different ethnic origin groups. such higher poverty levels among the elderly new wave immigrants are partly explained by their limited access to state support such as OAS, CQPPs, and occupational pensions. Their poverty levels would be lower if they receive the same retirement income as the Canadian-born British. The poverty levels of immigrant elders, particularly women and new wave group, and some ethnic groups from the old wave are indeed high on average. Yet, they are still protected from poverty by living with kin. Their poverty levels would be even higher if they had the same living arrangement as the Canadian-born British. Our results of the high poverty levels among ethnic minority seniors from the new waves of immigration have policy implications. Under the current system, immigrants have to wait 10 years before they are qualified for the OAS GIS, which reflected the lower take-up rates among the elderly from the new wave. In the meantime, the International Social Security Agreements, IASA, allows seniors to receive pensions from their origin countries and to account for the period of residence in their home countries into the resident requirements for Canada. To date, Canada has reached the IASA with 50 countries, and 40% of them are in Europe. However, major source countries of immigration in recent decades, such as China, India, Iran, and Pakistan, have no such agreements with Canada. There was in fact a call for reducing the residency requirement from 10 years to 3 years from some ethnic communities in Canada, and was indeed discussed in the House of Commons several years ago. But given the current political climate, this will be a hard sell, unfortunately. That said, however, our research suggests that the economic well-being of the elderly requires further policy interventions, although the poverty among elderly minority immigrant seniors tend to be overshadowed by the overall decline in elderly poverty. A social policy change like raising the OAS GIS minimum eligibility age would further exacerbate the income insecurity of elderly immigrants. Thank you for your attention, and I will appreciate any comments, feedback, questions from you. Thank you. Any questions from the audience?
This is not a question, but a comment. Something that is a little disturbing, but I saw in my practice as a social worker, people who, well, this is not specifically related, but people who worked for cash as caregivers and then got the GIS anyway because they hadn't paid into CPP. That's disturbing, but it's not really a comment on what you said.
Or is it because their official income is considered as
Yes.
low income?
Yes.
And do you think it is a major issue
Not
or something?
necessarily, no. Just something that I've seen can happen as taking advantage of the system. It's unfortunate.
That's true. And
Very unfortunate.
and our research is unable to see that kind of income
course,
because the
of course.
data from the census
In
data
general,
on
though,
the-
it's a wonderful system. I've helped people get GIS, and they really need it.
That's true.
Yeah.
Again, GIS is really based on the income. So if
Right.
your income is considered as like a low income, below like or then you are qualified. And the current debate has some implication. The current debate of shrinking increasing the eligibility age from 65 to 67 does have implications.
I've also seen the distress, and again, slightly unrelated, that people go through when they have to wait 10 years. I've seen a friend send her mother to the States to a nursing home because she couldn't get OHIP or couldn't, get an income here because she hadn't been here that long when she developed dementia. Because that's where she was from. but there was support there as well. But it's one of those situations that 10 years can be a real hardship.
That is true, and probably because of such struggles among some ethnic immigrant communities, I would say even several years ago, there was some movement, there was some motion among specific ethnic communities, especially in Toronto, to try to shrink the eligibility period from 10 years to 3 years, which didn't work, unfortunately. But thanks for your comment.
What drove you to focus on this type of research?
Oh, that is a very interesting question. Actually, this, as I said in the beginning, this research is a collaborative work with Professor Monica Boyd, who is sitting over there. And originally we were interested in the poverty among immigrant children, but then when we were checking the census data, we just find out that there is a large gap in poverty levels among Canadian-born elderly persons versus foreign-born elderly persons. Although we were originally interested in children, and then we were very fascinated with such huge gaps in poverty rates among elderly immigrants and elderly Canadian-born. And at the same time, we knew that the overall trend that poverty among elderly, on average in Canada, has been shrinking, has been declining for the past 30 years. And then always, in many cases, the government is seen as a major contributor to reducing the poverty. And then, but if we just focus on elderly immigrants, their poverty levels remain high. And then we're interested in what makes their poverty level such higher compared to Canadian-born. And then, thankfully, census data helped us answer some of the puzzle. I mean, I know that we're not able to answer all the differences, but at least we're able to find out the impacts, what impacts that state policy and living arrangement, living with their family, will help understand such gap.
So sorry, what is the implications in this research study? Like, how is it going to be used? Like, are you guys publishing it at this moment?
Yes, so this actually, the presentation that I had just now has been already published in the Canadian Journal of Aging, actually last spring. So if you go to the CJA website and search me or Monica's name, you'll be able to find our article.
So like, has the government at all like put any specific focus on it? I mean, I think politically speaking, I think that there's a huge discrepancy among the elderly population and how much income they have and how much money they generally have in order to survive a well-to-do life. And I think that your research was really interesting because it really kind of it really focused on that specifically. So, like, have you gotten any like responses from anybody or any interest in your research?
Not that I know of, but did you?
The current government's main objective is to try to deal with what they consider to be fiscal deficits in the funding of old age income security. So that the primary emphasis has indeed been on raising the age of retirement. There's always a risk in general platitudes that you exclude the marginalized. I think our research has to be taken within that context. So the two kinds of mantras that are in existence today are one, the income security program for the elderly will go bankrupt. That's rubbish. We don't talk about our defense budgets going bankrupt. It has to do with political prioritization rather than with actual fiscal funding. But that is one of the mantras. It's going to go bankrupt. And then the other is that in fact life is getting better and better for the elderly, which on aggregate it is. But you always have to. I mean, the kinds of research that I do as a social scientist, and that Lisa, as someone interested in inequality and particularly poverty, is to try to look at the contrarian facts, to look at the marginalized, to look at the sort of periphery in which those kinds of sayings don't hold. And so to answer your question rather concisely rather than elaborately. No, there hasn't been that much interest. People in the government certainly are aware of it. But I think the real question is that the focus is elsewhere.
It's just a little surprising in my opinion because of the fact that we have such a large population of elderly individuals, and slowly more and more individuals are becoming elderly because of the baby boomers, right? So it's just such a shocking fact because we have been so accommodating in their ways, and we've been letting in so many people into this great nation. But at the same time, we're not really able to provide them with all the necessary care that they need. And I think that both of your research, it's just, you know, it really highlights it, and I really, really enjoyed it. Thank you so much for that.
Thank you very much.
If I could just make one other point, which comes out clear in Lisa's presentation. In a laissez-faire capitalistic economy, the mantra of individuals providing their own safety net is one of the pillars. And what our research certainly shows is that family is important in reducing what would be extremely high levels of poverty. There's no question that, again, a general fact being that elderly women who are living alone are the most poor of all groups, and this holds within ethnic groups as well, within specific ethnic groups. But that many of these recent ethnic groups, in terms of their arrivals, are in fact protected somewhat by even higher levels of poverty by the fact that they have family members living in the same household with them. So, you know, if you want to argue that one of the drivers in thinking about public policy these days in government, certainly in the federal government sector, is what involves minimal state intervention. Our data do suggest that, well, families are doing the roles that they should be doing. That leads us to a whole other level of discussion on which our research is not addressing, but others have, which is, do people really want to live in family settings? And the research that I did in the early 1990s, which is published in the International Migration Review on living arrangements of Canadian immigrant women, shows that, in fact, a lot of these women are living in homes because they're poor. And more qualitative analysis done by people in the Guelph area show that when you ask elderly women, do you want to live with your relatives, they all say no. They want to live within 2 to 3 to 4 to 5 blocks of the relatives, but they don't want to live underfoot. And that, of course, is a 19th century concern as well. I mean, you know, in the first half of the 20th century, if you talk to people, they didn't want to live. They didn't want to be poor kin living with relatives. It creates all sorts of vulnerabilities in terms of your capacity to manage your life, in terms of your ability to resist what other people tell you. Some of the research on elderly women has shown that they're brought in and they're told, well, you're the babysitter now, right? You're the cook, you're the cleaner. This is your job. We're supporting you. They don't want that. So.
And just to add to what Monica said about the high poverty levels among people who are living alone, actually our paper has some like concrete statistics, and just to give you some numbers, so like 79% of women from the new wave immigrant groups who are living alone were in poverty in 2006, almost 80%. Or the similar as men, 75% of male immigrant elders from the new wave people who ethnic groups who came 1970s and older living alone were in poverty. That really tells you the very high poverty levels among who are living on their own without getting any support, financial support from their co-residing family members. Any other questions or?
I just had more of a comment as well. So you said that the new wave was when they immigrated after 1970.
The ethnic groups that are typically have immigrated.
And when was the old wave? Because I was just wondering if culture shock maybe could be an artifact of why these kinds of things are happening, where, you know, the elderlies that are coming into the country nowadays, well, I guess from the 70s, wherever you want to take it to present, are so used to living their life. So when they immigrate here, they're not really integrated within Canadian society, but they go to their cultures within Canada. So we know we have sectioned off Greektown, you know, Little Italy, things like this. So I'm just wondering if that's also a reason why women and men are seen to be in poverty. This whole
Among
aspect
the
of culture shock,
old
right?
wave groups. Well, culture has like lots of implications. But one would be that if you are not culturally integrated, socially integrated into the mainstream society, one indicator would be that you have less information to the government support or the pensions or OAS that are available, and you could make a choice whether you take it or not. But some people may not even have the information, maybe due to their language barriers, or maybe due to their families not familiar with how government social support works in Canada. Then that might lead to like a lower take-up rates of like OAS, even though some of them might be eligible, but they just don't know. And then in that case, like a culture may speak, like, may explain some of the like huge gaps, like huge higher poverty rates among the new wave immigrant groups that are composed of ethnic groups that have like a shorter history of immigration to Canada. That is a good point. I guess Susan is not here, so maybe I should be wrapping up. But well, thank you so much for coming all the way. And as I mentioned, so the paper that Monica Boyd and I published, on which this presentation is based, has been published to the CJS. So I'm more than happy to give you more details of the issue numbers, the page number of this paper after this talk. Well, thank you so much for your time.